As a pediatrician for over 38 years, I can say that our primary goal is to educate parents about preventing disease. Vaccines have been the most important development in public health, second only to clean water. When I was in training, and I was early in my practice, we did not have a lot of the vaccines that we have today. These vaccines prevented a lot of the bacterial infections that would put kids in hospitals and unfortunately resulted in many deaths. Imagine watching a child literally choking to death right in front of you due to a condition called epiglottitis. This is a bacterial infection that would progress rapidly and can come on suddenly due to a bacteria called Haemophilus influenza B. And the Hib vaccine was not available back then to prevent that. When my second child was 9 months old, I was given the opportunity to enroll him in a study for the Hib vaccine. As you can imagine, I jumped at that opportunity and enrolled him as soon as possible. When the Hib vaccine did come out, and then afterwards the pneumococcal vaccine, we saw the incidence of most of these bacterial infections plummet to nearly zero. Do you believe in miracles? I certainly do, as so many of these vaccines have had such miraculous results. And yet today, more families than ever are refusing to vaccinate their children in this country. We have simply vaccinated ourselves into complacency. Our parents don't recognize what these infections can do to their children if they're not vaccinated. Most of our pediatricians haven't seen children with these conditions, and I worry that they may not be able to recognize them soon enough to initiate treatment to prevent such a disastrous outcome. I think we are looking at a public health nightmare. I have been a member of TIP, the Immunization Partnership, for many years. I've served on their board, and I had the honor of serving as chair of their board of directors. I can tell you that TIP exists to educate families about the importance and the safety of vaccinations. We need to work harder than ever to combat the anti-vaccine messaging that is prevalent in our society, and working together with TIP will provide us the opportunity to do so.